Hello everyone, in this video I'll be explaining on the introduction of sterilization, disinfection and antimicrobial agents. Coming first to the sterilization. Sterilization, it is a process by which an article, surface or medium is made free of all microorganisms either in the vegetative or spore form. And disinfection means the destruction of all pathogens or organisms capable of producing infections but not necessarily spores. All organisms may not be killed but the number of the organism is reduced to a level that is no longer harmful to health. Asepsis is the practice of using antiseptics to eliminate the microorganisms that cause disease. Antiseptics are chemical disinfectants which can safely be applied to living tissues and are used to prevent infection by inhibiting the growth of microorganisms. Next, coming to the universal precautions. What does it mean by universal precautions? Universal precautions refers to the practice in medicine of avoiding contact with patients' bodily fluids by means of the wearing of non-porous articles such as medical gloves, goggles, and face shields or masks. And universal precautions are control guidelines to protect workers from exposure to diseases spread by blood and other body fluids. Antimicrobial agents. These are the drugs which are used against microorganisms. The tests done to check the action of antimicrobial agents against microorganisms are called as antimicrobial sensitivity tests, and antimicrobial sensitivity tests are of two types: diffusion tests and dilution tests. And there is interpretation of this antimicrobial susceptibility testing, where the results are interpreted as susceptible, intermediate, susceptible, or resistant to the different drugs. The drugs will be tested whether the patient or the organism causing the infection is susceptible to these particular antibiotics, or they are intermediate susceptible or resistant to a particular antibiotic drug. The bacterium is said to be susceptible to an antibiotic or antimicrobial agents when the bacterium is inhibited by the concentration of the drug, usually achieved in the blood following administration of the drug at the recommended dosage. A bacterium is said to exhibit immediate susceptibility when it is susceptible to the drug administered at higher than normal dosage, or when the drug has clinical efficacy at the body site where the drug has physiologically concentrated. A bacterium is said to be resistant to the drug when it is not inhibited by the drug administered even at higher than the normal dosage, or when specific resistant mechanisms are present in the bacterial isolate. In such an instant, the antibiotic should not be used for treatment. So this antimicrobial susceptibility testing is done to check whether the bacteria is resistant to the drug or susceptible to the drug or intermediate susceptible to the drug, and then proceed for the treatment.